Well, the $100 billion the government spent over the past 2 years to combat the COVID-19 crisis shielded Singapore's economy from long-term damage. It saved jobs while helping to boost worker employability. Well, the insights revealed by the Finance Ministry also found that the country's vaccination drive was crucial in saving lives. Li Liying tells us more.
A long-awaited return to the stage. Like many in the arts sector, this professional Chinese dance company was uncertain about its survival when the pandemic hit. But this weekend, these dancers will perform before a live audience again, thanks in part to the Jobs Support Scheme which kept the company afloat.
Over the last 2 years, SCDT actually managed to get over 300k of job support scheme. This can actually allow us to maintain or to keep all of our employees. We have about 14 of them. We have dancers and also some admin staff. I would say we are lucky. We managed to keep all our employees without any pay cut scheme. So that allows our dancers to continue to train, and also our choreographers to do their work.
The dance company is just one among the many firms which benefited from the scheme. The paper released by MOF evaluated the impact of key programs like the JSS. It found that about 165,000 jobs were saved from March to December 2020 after a total of $28 billion were dispersed between April 2020 to December 2021. The paper built on an interim report published in February last year. The ministry added that the longer period of observation and the collation of more detailed data allowed for a deeper analysis into the full effects of the economic measures. In the short term, Singapore's fiscal measures and monetary policy made an impact on the country's gross domestic product. GDP grew to 7.6% last year and would have been about 6.8% without the support. In 2020, Singapore's economy weakened by 4.1%. Without the schemes, it could have been 10.7%. The paper also found that without the fiscal or monetary policy support, the resident unemployment rate would have hit 6.1% in 2020 and 7.5% in 2021. That's a difference of 2 percentage points for 2020 and 4 percentage points for last year. In assessing the longer-term outcomes of COVID-19 measures, the report found that economic scarring and loss of human capital were prevented. For example, the measures mitigated the unequal impact of the pandemic, which had a greater effect on the poor. More social support was targeted at lower-income groups. In 2020, members from lower-income households received about $3,000 from COVID-19 schemes compared to the national average of $2,200 per household member. Singapore's public health measures and vaccination drive also saved lives. This was evident when the Delta variant infections peaked between August and December last year. The measures helped avert an estimated 8,000 deaths, 33,000 severe cases, and 112,000 hospitalization episodes.